Welcome to Libman Education's ICD-10-CM PCS Coding Clinic Update for first quarter 2017. My name is Barry Libman, and I will be leading us through today's program. Hypertension and congestive heart failure. This question addresses some confusion surrounding the index and the tabular on the topic of hypertension and congestive heart disease. Let's have a look. In the guideline for hypertension with heart disease, category I-50, heart failure is included in the list of heart conditions that are classified as hypertensive heart disease, but not included in the alphabetic nor tabular list, pointing out that the guidelines give us a definition to hypertensive heart disease, but is not consistently defined within the alphabetic or tabular list. The question posed is congestive heart failure in a patient with hypertension coded as hypertensive heart disease with failure when the provider's documentation has not explicitly linked the two conditions? A very good question. Coding Clinic answers the question by telling us to assign code I11.0 for hypertensive heart disease with failure, along with the appropriate code from category I-50, which you recognize as the code for heart failure. The classification presumes a causal relationship between hypertension and heart involvement unless the provider documents that the conditions are unrelated. That's a very important statement. Coding Clinic goes on to address some of the confusion by telling us that although heart failure is not in the list of heart conditions in the inclusion note, there is a note instructing use additional code to identify the type of heart failure in the tabular list. The code range under I-11, hypertensive heart failure, is not intended to be an all-inclusive list, but Coding Clinic goes on to admit that perhaps it should be and could be by indicating that the range of heart conditions in the alphabetic and tabular index will be considered for future modification through the Coordination and Maintenance Committee meetings, meaning, optimistically, that the alphabetic index and the tabular list will likely be amended in upcoming years. Let's take a look at the topic of hypertension and congestive heart failure and see that it may not be very confusing after all. Let's start by looking at the guidelines. Guideline 1C9A, hypertension, tells us that the classification presumes a causal relationship between hypertension and heart involvement and between hypertension and kidney involvement, as the two conditions are linked by the term with in the alphabetic index. These conditions should be coded as related, even in the absence of provider documentation explicitly linking them, unless the documentation clearly states the conditions are unrelated. Guideline 1C9A1 helps us understand the definition of heart disease within the guideline. Hypertension with heart conditions classified to I-50, what we understand to be the code for congestive heart failure, or I-51.4 through I-51.9, are assigned to a code from category I-11, hypertensive heart disease, with the instruction to use an additional code from category I-50 to identify the specific type of heart failure. We've reviewed the guideline for hypertension with heart disease, so now let's have a look at the ICD-10-CM index under the main term hypertension. And there you see hypertension with heart involvement, conditions classifiable to I-51.4 through I-51.9, just like the guidelines tell us. There we see the inflexible instructional term, see hypertension heart. And down below, we have a snapshot of the index at hypertension heart, which shows us heart disease, and again, a rephrasing of I-51.4 through I-51.9 due to hypertension, and we should use code I-11.9. However, if that is with heart failure, we would then use I-11.0. Proper coding technique leads the coder from the ICD-10 index to the tabular list, and at the tabular list at code I-11 we see hypertensive heart disease with heart failure, and again the instructional note to use the additional code to identify the type of heart failure. So what's important here is the inclusion note, which says any condition in I-51.4 through I-51.9 due to hypertension. And you'll notice that they use the phrase due rather than the word with, but that's okay, and we'll explain why in a moment. In the tabular list, when we go to code I-50, we see the code first instructional note that says, among others, heart failure due to hypertension I-11.0. And again, we see the phrase due to. To help us understand the use of the term with and due to and what they mean, we refer to the guidelines, and we go to General Guideline 1A15, with. The word with should be interpreted to mean associated with or due to when it appears in a code title in the alphabetic or an instructional note in the tabular list. The terms are interchangeable. So when all is said and done, in other words, if a subterm in the index says with, the documentation in the medical record does not have to link the two conditions. The link occurs in the index and does not have to occur, as I've said, in the medical record documentation. If you have any questions or comments, please contact me at the phone number or email shown on the screen.